Hello, good afternoon. As Ms. Catherine said, I'm Amolika Saini, second year medical student. I will be presenting on the association of sociodemographic characteristics with pediatric vision screening and eye care. So before we start that, I do want to talk about what vision screening is and why do we emphasize vision screening and exams. So healthcare organizations and associations like the Academy of Pediatric Ophthalmology and Strabismus, they recommend that vision screenings are conducted at an early age so that they can identify risk for vision problems and prevent long-term healthcare consequences like learning difficulties or social challenges that can be prevented when you do early detection and take care of it. So who are we talking about in this presentation? We will be focusing on the pediatric population. This is a screenshot of the data and the statistics that uh, Health, Healthy People 2030 has published on their website. And it does talk about the number of children per thousand who are blind or visually impaired. So in 2019, the baseline was 39.0 per thousand children. And in 2022, as you can see, it's 50, which has increased. The target has been 31.2. And as you can see, the target needs to be met, but the status is that it's getting worse. So what can we do? We can actually help by looking at what can be the potential variables that can be affecting the screenings, and we will dive into what this study talks about. This is also one of the graphs in the same website, and it shows the trajectory over the 4 years. So starting from 2019, it has only gone up, and you can see the baseline is the flag region, which is 31 right here. Moving on. So the study that I'm talking is focused on sociodemographic variables, and it is a cross-sectional study, which was done by the National Survey of Children's Health over June 25th, 2021 to Jan 14th, 2022. So for this one, the survey was sent out by mail or it was sent online to homes by doing address-based sampling. The households were identified by looking at the ones that had children under 18. In those households with multiple children, one child was chosen randomly for this survey. And the survey was performed by the parents and the caregivers of the children in those age groups. And they looked at different characteristics like personal health, parent-related characteristics, and the demographics. A total of 50,892 surveys were completed and analyzed. Now we look into what the questions were asked for this study. So the three main questions that were asked during this study were, first, how many children performed the vision screening in the past 2 years or ever if they were under 5 years old. Second question that was asked that how many were the children and related to the children were sent to referred to the eye doctor or eye specialist. Third category, which was observed and analyzed, was the ones who actually visited the doctor's clinic and received care for their vision. Let's dive into how the data was analyzed now. So for the analysis, two main tests were conducted, the Pearson chi-square test and the logistic regression model. Both of them were used to test the differences between the variables, including univariable and multivariable. They found out the odds ratio, adjusted odds ratio, and the 95% confidence intervals. Now, the significance level for this one was p-value of less than 0.05. Let's see the data now. For the first category of the vision screening, so the children who went through vision screening, total of 53.18% out of those 50,000 completed surveys received vision screening. And in all these categories that I'll be talking about, all of them had a high percentage of vision screening, especially ages 6 to 12, which had 65% of vision of receiving vision screening. Okay, and for the race and ethnicity, the highest percentage that received vision screening was were the non-Hispanic white in comparison to the non-Hispanic others. And then next one, CSHCN are children with special healthcare needs. They had a higher percentage of receiving vision screening. And for the insurance type, higher were the ones that who had private insurance. Households that had English as their primary language. The ones that had education, whose parents had education higher than high school, and the family incomes who had the families who had income above 400% of above the federal poverty line. And out of those, 53% that received the vision screening, 26% were referred. So you can see that 1/4 of the people who got screened were referred. So if 100% received the vision screening, it would have increased the value of children being sent to the specialist, because if you don't get screened, then how would you know that you need to be referred? And then for this particular category of ages, the teenagers 13 through 17 had the higher percentage of being referred. And for the second category, we have the data for the ones who were referred to the doctor post vision screening. We've already talked about the percentage, and now we'll talk about the demographics who were significant for being referred. Race and ethnicity played a huge role in being referred to the specialist. Children with special healthcare needs. Healthcare visits in the past year, the children who did not have a healthcare screening in the last year were referred more. In comparison to the demographic of sex, female and male, they were insignificant for being referred. And parents' education was not a factor that played a role in the number of children that were referred to the doctor. For the insurance type, which can be seen right here, it is significant when you look at the odds ratio. But when you adjust for the sociodemographic characteristics, it's not significant when adjusted. Okay, for the third category, this is the category who went for the actual physical eye exam and received care. Disclaimer, this does not relate to if the pediatric patient was sent post-referral or before the vision screening. So this is just based off of if they went for vision exam. Just to preface, vision screening is what is done before So it includes like the far vision tests, the RDE tests, which are more community-based, and eye exams are more doctor clinic based, doing the slit exams and checking, getting checked by ophthalmologist or optometrist. For these categories, 38.6% had went for the eye exam and received care. For the ages 13 through 17, they had the highest percentage of going to the doctor for the eye exam. So you can see that they were referred at a higher percentage, and they went for the exams more often. So that is compliant with being referred. Race and ethnicity did not have a huge role in defining if they went for the eye exam, nor did the healthcare visits, nor did the parents' education, nor did the household income. So you can see there's a big difference between people who are getting the vision screenings and the people who actually went for the exam. And for the corrective lenses, so the care that they received, so 38% went for the exam, and 55%, more than half of the percentage, received corrective lenses. So they did need care, that they needed to be taken care of and prevented from further vision loss. For the healthcare visits in the past year, when you look at the corrective lenses, healthcare visits in the past year, household language did not have a role in the corrective lenses being prescribed. Okay, so moving on to the discussion, I did make a table where we talked about different categories. I just put it into which category were significant and which demographic. So 3 categories were the ones who got vision training, second were who were referred, and the third were the children who actually went for the exam and received care. So for the first category, all of the categories, the age, special healthcare need, and insurance type was highly significant. So if you needed more healthcare, then you had a higher percentage in all these categories. For all the categories but corrective lenses, the household language was significant. So corrective lenses did not, so household language was not significant for the ones who got corrective lenses. Similarly, household income was significant in all categories except the eye exam. So it did not matter with the house income if people went for the eye exam or not. The category which was this demographic which was significant only in the vision screening was the parents' education. So the children whose parents who had higher education, more than high school, had greater percentage of children getting their vision screening done. So you can see there's more, the education plays role in how the parents take care of the children's needs and continue with annual screenings for their children. And then last category was eye exam only. So the demographics most significant were gender, race, ethnicity, and healthcare visits in the last year. So the children who went for the exam, these demographics played a significant role. As talked about earlier, the highest referral rates were for the older children, special healthcare needs, and the non-English speaking households. We do talk about the effect of pandemic when we see the study was conducted during or almost when it was ending. The children didn't have access to schools or they have limited access to healthcare. Limitations related to the study were since since the children were not the ones who responded to this study, who actually went through through the vision screening, they were mm, the surveys were performed by the parents and the caregivers, so there might have been a reporting bias involved. As I talked about the terminology, there might be cases where the parents or the caregivers needed more uh, understanding of the terminology. For example, vision screening versus the eye exam. That might have caused a discrepancy in the results. Next one is, as mentioned before, when we talk about the children who went for the pediatric eye exam, they um, the survey doesn't show if this vision screening was done before the exam or after the exam. And last one was low response rate. So almost 40%. So the survey was res only 40.3% of the people who were sent out, households who were sent out this survey, uh, performed this. So 50,000 was 40% of the surveys that were received. In conclusion, when we talk about the different demographics that might have in might have not caused but correlated to the vision screenings and the eye exams can be uh, reduced if you uh, spread more awareness about the healthcare initiatives about and develop more health literacy programs. As we saw that the parents who were more educated, they sent their children and they were more aware of getting screenings done and getting the eye exams done. Improved access. So improved access can help with increase in getting more vision screenings done and getting more children diagnosed if there's any uh, vision abnormalities. The study was done cross-sectionally, but it would have been better if we do a longitudinal care and have a trajectory of a particular child and see what their how their vision is progressing or diminishing. The next one is language barrier. So one of the factors uh, that we discussed was correlated was language. So if we improve the literacy and provide uh, inclusive, uh, more inclusive facilities like interpreter or multilingual providers that can help with improved access to healthcare. I did receive an email by Dr. Newman. He was supposed to come for the presentation, but he gave his amazing insight into how he actually faces vision in his clinic. He really appreciated the score one for health, which I do appreciate. That's an amazing initiative by our school. Um, Dr. Newman mentioned that uh, in the state of Missouri, the recommendation is a screening, like the vision screening once per year for children. But unfortunately, this program, not these screenings, the vision screenings, are not state funded. Uh, Not state funded. The organizations, like private organizations, can provide vouchers, but still, children who are on Medicaid, they can only get screened once per year, and for the frames, they can only get prescription once per 2 years. So it gets a little bit iffy with insurance because the providers have to work harder to prove that the patient does need new glasses in less than 2 years, and that kind of makes it hard for the vision to be monitored that often. Also, if you have private insurance, Dr. Newman mentioned that there's additional eye or vision coverage that you need to get that's additional to the health insurance, which does affect how the families. Um, so it is a very subjective portion where it can depend on the families. And coming back to it is the issue is deep rooted since children are highly dependent on their parents, and it's a long process to bring a change if when needed because children are not the sole people who can change, but it depends on the parents how they proceed with the information that they get and how they can help with preventable vision loss. And that was the end of my presentation. I wanted to raise awareness with the importance of vision screenings and diagnosing vision loss so that you can prevent it from getting worse. Thank you.